Many seniors spend their lives caring for others, but when it comes to their own mental health, too often they suffer in silence. According to the CDC, as many as 7 million Americans over 65 suffer from geriatric depression. And joining us now to talk all about it are Dr. Bernie Ranchero and his patient, Connie Thomas. Good morning to you both. How are you doing?
Thank you.
Thank you for having us.
Dr. Ranchero, research shows millions of seniors struggle with mental health issues, yet many don't seek any kind of treatment. From your perspective, what are the biggest barriers and why is talking about it the first step in breaking them down?
One of the biggest barriers in geriatric depression is just the recognition that as we age, it's not healthy that we socially isolate ourselves, that we withdraw, or that we experience feelings of hopelessness, and that there's help available, talking to your loved ones, talking to friends, talking to family, and talking to your healthcare provider.
Connie, did you find it hard to talk about your mental health, and what ultimately encouraged you to open up?
No, I really didn't have a hard time talking about it because I realized I needed help. And I had had breast cancer in 1987, and 6 months later, I'm going through the same surgery again. And I had 3 small children at home, and I was a single parent, and I always worked and provided. And now I'm in a place where I can't work and I don't have an income, and I knew I needed help, and I couldn't do it, on my own, just thinking about it, what everything my body had went through. So I went to the doctor and he put me on medication. I had been on that medication for years and thought it worked, and just all at once it didn't work anymore. So I got a hold of Dr. Ranchero, which I had just retired, and I had always taken my grandkids to school every morning for 18 years. Well, they're in college and I don't have anything to do and get up in the morning. So what am I going to do all day? So I knew that I needed to go see Dr. Ranchero. So he did the gene test, and it came back that I was over medicated. So he adjusted my medication and he put me on the right track, and I've been happy and a different person ever since.
Doctor, how does genetic testing help empower patients to have the talk with their doctors, and why is it especially valuable later in life?
GeneSight testing is a simple test that we do, a simple cheek swab that we take, and it's done once in your lifetime. And it helps us to determine which medications out of the numerous medications out there would be best based on your individual genes and your individual DNA. And we can see which medications would be the best for your condition, the safest, the most tolerable, and mostly to help patients, especially with geriatric depression, to get better sooner and faster so they can live the lives that they're meant to live.
Connie, what would you say to other people out there like you who are experiencing mental health challenges?
I know a lot of people my age that are going through depression, and I would try to talk to them and share what I have done to help myself, and see if they could talk to a family member, or if they would go talk to their family physician and see that they would help them on some medication. And I had a family member that was deep depression, and I mean very deep, and she didn't want to get up in the morning. She didn't want to take a shower. And I talked to her, and I finally got her to go to her doctor, and he put her on some medication, and she is a complete different person. And I don't know what would have happened to her if I hadn't talked her into going to the doctor, because she probably wouldn't have been here. But, I will help anybody I can, because I've been through it and I know what it feels like.
Where can people go for more information on all this?
For more information about this genetic testing, they can go to GeneSight.com, and it is covered by Medicare, so cost shouldn't be a hindrance for them.
You heard the doctor right there. For more information on all of this, just visit GeneSight.com.